Hey guys, am I audible, visible? Just give me a second. Hey guys, am I audible and visible? If so, say me a hi and a hello. The ads are rolling, so I hope I'm audible and visible. Good evening, everyone. Sorry for the delay. I was supposed to join a bit early, a little bit of delay. Sorry for that. So we're going to continue the same thing what we saw in the lab instrument series, right? So yesterday or the last class, what we saw was about light microscopy, right? So we had this primary image, and based on that, we built out concepts on what is the use case of everything, and if at all, if it's asked in a Viva when you're standing in front of a microscope under the slide, because every examiner knows, this guy or girl knows the slides any which way, right? So I'm good. In fact, I hope you're doing good. So based on that, what we saw, right? Can I just ask you a few questions and see if you retained anything from the last class? Because I'm sure that you might have not gone back and read the notes on the Telegram, or you might have not revisited the video by default, right? Let's see if any one of you is able to answer the questions. Hi Munir, hello, good evening. So can anyone tell me what is the magnification part of an eyepiece? 10x, 20x, 100x, 40x. Options are also there. I'm good. Hope you're doing good, Munir. Magnification part is 10x, right? So we saw this nose piece, and these are the objective lenses, right? So there are 4 colors of objective lenses. Actually, everything has a power, and also it has color as a line on in the part of every lens, like what you saw in the last class, right? Can anyone tell me what is the color for the 40x objective? Anyone? And also, can anyone tell me what will be the color of an 100x objective? Because everything has a slightly different color. 40x objective has perfect. A blue line will be 40x generally, and oil immersion, that's the 100x, will have a white line, right? Okay, great factory. Fine. So these are few things what we saw. Okay, just tell me what is the another use of a stage. There's a stage here. Stage, the first use is to place a slide and to clip it, right? I told there's one more use of the stage. Can anyone tell me what's the other use of the stage? The other use of the stage is it also has calipers. It also has measurements. For a tumor, to measure the distance between tumor to the margin, or even to measure the size of the tumor, it's very useful. I also asked you guys, did you go and have a look in the practical lab? Did you see the microscope? Was there lines there? Was there markings there? That's helpful for markings as well, right? Perfect. So this is what we saw in the last class. Also, we saw, yes, Judge, it is also written. It will be written there, and also there are lines. Both are useful. One, it will be written 10x, 20x, 40x, 100x, whatever based on it, and 4x for scanner, and also will be each color for everything, right? Perfect. Okay. Now, what we saw yesterday was light microscopy, and also we saw a little bit variants of light microscopy, like a dark field microscopy, a phase contrast microscopy, and also the polarizing microscopy. All these are subtle variants from a light microscopy. In today's class, what you're going to see is this. This is called fluorescent microscopy. If just an image is given, and there's a question there which is there in an old AIMS exam, what microscopy is this? How will you take fluorescent microscopy and not light microscopy? Do you see any difference? First, you guys tell if there's any difference, and I'll tell you one exact important difference by which you can easily differentiate, this is fluorescent microscopy, it is not a light microscopy. Can anyone tell me what is the difference? Anything which comes to your mind? There's one important difference. In a light microscope, if you look, the arm, right, it's straight, and the light or the power LED light or the normal light, sunlight, comes from the bottom, right? And then you'll have an eyepiece. So here also I have the same thing. I have an eyepiece. Please ignore this. This is a camera setup which can be attached to a normal light microscope also. That is an extra attachment. That's not a part of the fluorescent microscope. I'll have an eyepiece the same way. There's a head which also helps them to rotate it, like what we saw last time, right? The biggest difference is the light source comes from here. So what happens in a fluorescent microscope is the light comes from here, right? And then it goes inside, hits here, and then it also reflects from here and goes to the eyepiece. So there's a dual direction. If you see a light source coming on the top and there's a chamber like it, via which the light travels. Actually, there are filters. If you can see here carefully, these are filters. I can say red light filter, blue light, yellow light, based on the fluorescent microscopy what we use, right? The light source from the top is one of the significant difference from a fluorescent microscopy compared to light microscopy. You have to remember that. And also it has a chamber which can produce lights here, right? Okay, that's a big difference. This light microscopy will not have anything of sort. There something in fluorescent microscopy will be protruding like this. If it protrudes like this and this light shows there, that's a fluorescent microscopy, right? First, next the principle. Why it is fluorescent microscopy? We use fluorescent microscopy for few very important diagnostic details which will be reading in the latter half of systemic pathology when the next batch, right? So why do I need this? And what is the difference here? Normal light microscopy, it's simple. Light comes, hits the objective, the slide, whatever it is, objective magnifies, eyepiece magnifies, I look at them. That's all. Clear? Very simple. In fluorescent microscopy, the mechanism is different. All of you must have, hi Swatika, good evening. All of you must have known the single white light has multiple colors. Yes? Have you read that in your physics? White light is a combination of every light available, right? So from the light source, like I said, light source is always from the sides. From the light source, all the light comes into. And I'll have a filter here. The filter will filter out every light. For example, I use a blue filter. Only that comes out. Rest everything will be stopped. From a white light, rest everything will be stopped, only blue comes outside. Okay, then it goes and hits the specimen. So again, going back to physics, wavelength at which hits and the wavelength at which goes away has a different thing. We call it excitation, right? So one filters here, hits the objective, and the second image will take it to the eyepiece. And there's one more important here is dichroic mirror. Right? The important thing about dichroic mirrors, it's very, very important. This came in an INSTD exam. Dichroic mirrors are seen in fluorescent microscopy only. I don't use dichroic mirrors in anywhere, right? Now, I'll tell you the simple concept of dichroic mirrors. Have you guys watched any foreign series or any investigation room? There'll be a person sitting there in the investigation room. The police will be standing behind. They can see the person, but the person can't see them. It's like a mirror. One-way viewable mirror. You must have definitely seen that in some movie scenes, right? Indian, Bollywood, Hollywood, whatever it is. It's similar to that. So what a dichroic mirror does is, dichroic, two colors. It will reflect one color and will allow another color. If you see here, blue is being reflected, right? Blue comes from here, it's been filtered out here, hits here and reflects. It goes niche. But on the other hand, when it goes, hits the objective, excites, produces a green color. Green color is not getting reflected. Green color passes through it so that I can see the objective. That is the important thing. So that I will filter out all the unwanted things and I'll only see what I require. So can anyone tell me, based on this concept, what will be the microscopic color of this image? What do you think? What all colors you think will you see in microscopy when I'm doing a fluorescent microscopy? This is a simple mechanism. I have a white light. Excitation filters takes out everything. Hits the image at one wavelength, reflects from the image with another wavelength, and that is passed through the dichroic mirror as one more filter comes to the ocular or eyepiece, right? So can anyone tell me what color will be the image? If this is the mechanism, what color will be the image? One color of the WebGR. It's not difficult to remember. What color will be the image? Come on, you guys know that, right? See that green color. There's only one green color coming outside, right? So what will be the background? Anyone? So most of the fluorescent microscopy images, we have one more name for it, immunofluorescent microscopy or fluorescent microscopy. Both means one and the same. Will be green in color with a black background because I don't have any other light passing through it. Only green color is passing. Why green color is passing? We'll soon see when you look at the mechanism. Green color passes, comes to my eyepiece, I see them, rest everything background will be black. The images look like this. They are beautiful images. Black, green, maybe a slight shades of green, but black and green, that's all. Black and green. This is how the image of fluorescent microscopy will be. I use them primarily for 3 use cases. I'll tell them in the last, right? So I'll have only green and black color because the mechanism of the microscope is such that the dichroic mirror, which plays an important part, lets only the green light to come outside. Different colors can give different light. Some might give yellow, some might give green, some might give red, based on the dye what I use and based on the dichroic mirror also, right? Based on that, I'll see the green and a black background. Perfect. Now, let's see what's the mechanism. I told there are 2 types of immunofluorescence microscopy, right? Fluorescent microscopy, I have 2 types. One we call it an direct immunofluorescence, or you call it direct IF. Okay. The other is indirect immunofluorescence. Fine. Okay. See, we call it DIF for direct immunofluorescence. Most of the images what we use for diagnostic pathology are direct immunofluorescence. We don't use indirect immunofluorescence for diagnostic pathology. We use it for research purposes. Diagnostic area, we'll have only one thing. That's your DIF images. So any question says there's a DIF image there, direct immunofluorescent image for kidney, for skin. You have to remember this number. Let's remember the name. This is primarily used for all the diagnostic pathology. Any diagnostic pathology what I have, I'm going to use direct immunofluorescence only. Fine. What's a mechanism? Okay. For mechanism to understand, we need a little bit basic concepts of immunology. We did cover about immunology, right? I'll give you one disease. Let's see if you can help me to understand the disease. Then it's very easy for me to diagnose. Though I don't use this disease for immunofluorescence, I'm giving an example. Have you heard about a disease called as myasthenia gravis? Yes, no, maybe. How many of you have heard about a disease called as myasthenia gravis? You must have, nah? You must have. What is the antibody against? Antibodies against? Perfect. Acetylcholine receptors. You must have read even in your first year, right? Antibodies against acetylcholine receptors cause a disease called as myasthenia gravis. As a diagnostician, my job is simple to tell this patient there are antibodies against acetylcholine receptors in the neuromuscular junction. If I can prove it, disease is right, I can start the treatment. Right? That's how it is. It's very, very simple. And that's where immunofluorescence comes into play. I'll give you a different example so that it's easy for us to understand. I'll tell you the exact pathogenesis, and also I'll talk about the disease, and also I'll talk about the diagnosis. So it's complete, right? Because this place we use immunofluorescence. We have a disease called Pemphigus vulgaris. We'll just call it Pemphigus for now. Okay? It's a skin cut disease. Fine. So in Pemphigus vulgaris, I have antibodies against, I'm not going into the exact thing. We'll keep cell junctions. Have you heard about in physiology, desmosomes, hemidesmosomes? You might have, right? Those are the intercellular junctions, right? Like that here, I have antibodies against a product called as Desmoglein. There are variants of Desmoglein, Desmoglein 1, Desmoglein 3, many of them. For now, we'll just remember Desmoglein, right? These are cell adhesion molecules between two cells in my skin. Now, what happens is a normal skin, you must have seen a normal skin in your histology, right? Lots and lots and lots of cells like this. So all these receptors, the Desmoglein, everything are cell adhesion molecules. It will adhere themselves to each cells. That's a job so that all of them are coherent like a single unit. I want you guys to answer here. Let's see if you're able to answer. Now I am telling I have a disease which produces antibodies against these connectors. So what do you think will happen? The cells will be together or the cells will flay apart? I'm having antibodies against these connectors. So cells will be together or cells will move away. What do you guys think? Obviously, cells should move away, right? Obviously. So can I say between the cells, I'll have a gap and there'll be an edema fluid accumulating inside the gap. It's an empty space. I'll have edema fluid accumulating, right? So what does is, because it's antibody, the cells which are adhered like this are being lost. I'm putting dotted lines to say it's lost. The moment it is lost, my skin, which was a single lining, now will separate. It'll separate like this. Little bit of skin is below, little bit of skin is above, and then here I have fluid. This fluid, I call it a bulla. You will read about the term very often when you go to dermatology, bulla. We use the term bullous disorders of skin. Fine? Okay? Understood? If yes, just tell me yes. That's enough. I want you guys to answer. What's wrong? I'm not going to kill you. I'm not going to scold you. Nothing. Please open up, right? Fakti is the only person answering. I want everyone to answer, right? These are bullous disorders of skin. Fine? Understood? Yes, no. Yes. Come on, guys, answer. So now my job is to diagnose them. So what should I tell? The antibody, this guy, is actually binding to the skin. If I'm able to tell that to a dermatologist, they'll be very happy. This is the exact pathogenesis of the disease. So my diagnosis is sorted, right? Perfect, Rajdeep. That's how it is, right? Now, what I do here is, I'll just give you an example of the principle or the mechanism of the immunofluorescence, right? So what do we do in immunofluorescence? I take a single tiny cell, okay? Assuming this is a skin cell, since we talked about Pemphigus vulgaris. In this cell, I assume the patient having a disease, so the patient will have antibody, right? Yes, the patient will have antibody. All this is happening in the biopsy, which I took from the patient, right? So this is what is there in the patient. There's a skin cell, the shaded one is a skin cell, and the white shaded one is the antibody stuck to the skin cell. So now, when it comes to the lab, what I do is, I add something called an anti-human antibody. See, these are antibodies of the disease, right? Don't confuse them into, what I add here is antibodies to human immunoglobulins. This I create in the lab. I create antibodies to human immunoglobulins. Where will they go and bind? They'll go and bind to this antibody, right? So this will bind to this antibody. This will bind to this antibody. This will bind to this antibody. This is lab made. So what I do is, while making the anti-human antibody, I add a green color dye, green color dye, green color dye. This dye also has come in the question. Yes, facty, antibodies for antibodies, and immunoglobulin is also protein, right? Obviously, to any protein, I can create an antibody. So I create that in the lab and I keep it, right? So I have a green color dye. This dye also came once in exam. We call it FITC, fluorescent isothiocyanate. Okay, so it's a fluorescent isothiocyanate dye, which is FITC. That is the reason, if I shine light to this, it will emit as green color, because it's a green color dye. Every cyanide dyes are green in color only, right? Now, okay, now when I hit light to this, this all happens in the biopsy, right? This, when I hit, will emit green color. Okay, now tell me, if green color is there in a microscope, can I tell, this patient had the antibody? Only when the antibody was there, my anti-human antibody can bind to it and the color can be there. Just assume the patient is normal. We take a biopsy of you or me. I have only skin, no antibody to it. This is a normal person, right? To this, again, normal skin, I add the human antibodies to human immunoglobulin with the dye. Is there anything to bind here? Yes, no, maybe. It's a normal skin, and this is my lab reagent, right? This is the lab's reagent, what we add in the part of the test. Is there anything to bind? Nothing to bind. There's nothing to bind. Will I have any color? No. Light hit, no green color, will be gone, because the dichroic mirror will allow me only green color. So this will be completely black, right? So if there is no antibody in the disease, which means there is no green color, which means it will be black in color. In other words, every other piece of the biopsy will be black in color except for the place where the antibody is bound, right? Right. Now, let's take the same skin biopsy. The skin, okay? I told that the skin here will have all these round ones are the keratinocytes or the skin cell, right? Okay. Where do you think the green color will bind? I told the antibodies against desmosomal, hemidesmosomal proteins. Where do you think you will see green color? I'll give you two options, at least say one or two. Will I see green color here in the center, or will I see green color here in the corner? If you feel you will see green color in the center, tell 1. If you feel you will see green color in the corner, tell 2. Where will you see? The concept is simple. The disease is antibodies against desmosomal proteins, which are intercellular adhesion molecules. So once the antibody is there, my anti-human immunoglobulin also will bind there. I'll have a green color, 1 or 2. Perfect. I'll have in 2, because that's where the proteins were, right? So what happens now here is, I'll have antibodies here, 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 right? So not just one cell. It's a systemic disease. So every cell of the skin biopsy will have colors like this. That's what looks like this in a biopsy. Beautiful. This is skin biopsy where every cell ka margin has antibodies attached to it, and in a fluorescent microscopy I have this. This came in an MCQ exam. This will be repeated multiple times again and again. This has a name called as a fish net appearance, which is a characteristic sign of Pemphigus vulgaris. Okay, in Pemphigus vulgaris, you have a very characteristic sign present, fish net appearance. This is important for you to remember. If you're writing NEET, PG, INICT or FMG, it's very, very important. We have to understand that. So where all do I use direct immunofluorescence? There are three important use cases of direct immunofluorescence. One is in bullous lesions of skin. Okay, skin conditions, Pemphigus vulgaris, bullous pemphigoid. There are lots of them. You'll read when you go to final year. Second is glomerulonephritis. Again, when you come to kidney chapter, we'll read lots of them. The basic is this, that's all. Third is quite a few immunological autoimmune conditions. Okay, in quite a few autoimmune conditions, we use them like SLE. We have immunological tests like Sjogren's syndrome. We'll read them in the next class in your Nishchay batch, where all these places we use them. These are three simple use cases of your direct immunofluorescence, right? Never forget this. And Fishnet appearance can come as an MCQ. This is a glomerulus. Beautiful glomerulus is having the green and black color. We'll see how to interpret them when we come to glomerulus or kidney ka chapter, fine? So that's simple thing about a simple immunofluorescent microscopy. Difference is I have a light source coming from the top, not from the bottom alone. Two light sources, and there are filters. Filter will allow one, hits the objective because of the green color, excites and produces one color. Dichroic color reflects some, allows some, so that I can see the green color alone and the background will always be black. And the principle is simple. I have an antibody in the disease. I had anti-human antibodies along with that a dye. This dye is important. FITC can come in an exam. That gives the green color. So there is no antibody, no dye, no green color. And we took an example of your skin, Pemphigus vulgaris. It looks like this in a biopsy called as fishnet appearance, right? Okay, that's all for today. Any doubts, do let me know. You guys are pretty quiet audience. It's okay, but sometimes we'll have lots of series, lots of discussion. I want you guys to open up, ask random questions. It's fine. You might sometimes when you ask a random question, you might sometimes try to read something, try to learn something out of it, right? So you guys, hopefully in the next class I want more interactive people and hope we'll have fun. Faculty, my next class will be next week. I am going to torture you with 6 classes continuously. From next Wednesday till the next Tuesday will be my class. Fine. We'll have Christmas, New Year, everything with pathology.